How do these major tragedies, like I mentioned, Tumbler Ridge is one that's in a lot of people's hearts after last week. How does this impact first responders?
Even if you're not on the ground responding to this, you hear of these situations and you can relate to them because you have your own stories and your own experiences. So everybody who had heard about the story is shocked and just sad for everybody that's involved.
How often do you see that people can become a bit insular about these circumstances, right? Hold a lot in, not share a lot, and then struggle with having all that bottled up emotion and thought process?
It happens every day. Even
Does it?
myself, like we talk about it, but we don't talk about it on a deep level, right? We just discuss the tragedy that happened. We don't discuss everything that's going behind the brain in that.
How often are resources even spoken about too, that you can reach out and gain some help?
It's getting better.
Yeah.
The more and more that people realize that nonprofits and charities are out there for them, the better that they're getting the work or the help that they need.
What are some of the biggest challenges that you see members facing in the first responder members, I mean?
The biggest challenge is individually reaching out and finding that strength within to admit that you need some help and finding that help. That's the biggest challenge you're going to see.
And now, I know that you had mentioned that you yourself have gone through moments of suicidal ideation. Why do you think suicide prevention is so integral to what you're trying to provide through the association?
As the AFRA, our goal is prevention and not intervention. We're not professionals in that manner, but we want to provide some tools and resources for people like myself to be able to access immediately and not have to Google everything and hope they find the right thing within time.
How much do you see suicide come up as a topic? Maybe not even prevalently because a lot of people aren't speaking about it, but how often do you see this impacting first responders?
You don't really hear about it until it happens.
Right.
Yeah, that's the only time that people really talk about it. You're not sitting down in your social groups and talking about suicide. It's just, it's one of those ugly things that you do not want to talk about.